Hey guys, this is Hannah, and today is January 5th, and I just got an email from my friend who just said that she got into a disease, kind of like a rare disease, but it's actually not. It's just a little bit rare, and not a lot of people know about this. But that really just triggered me to think that maybe it's time for me to do something. Like, for what I've known, a lot of people like me, myself, we don't really know a lot of things about rare disease. Maybe we've just heard about it before, but we don't know the actual definition about rare disease, and we don't know what diseases it actually includes. So maybe I can spread some knowledge about rare disease to the public by making some interviews and make it all into a video, and let's see if I can do more. Okay, so today is March 4th, and I just got the contact of Fabry disease organizations, and I'm so excited. And let me introduce you the process of me getting the contact. So first, I asked my biology teacher in my school, Mrs. Chen, for some connections to those rare disease organizations, and see if I can make an interview with them, right? So she introduced me, Mr. Huang, a professor in Peking University. And he has some contact and connections for those organizations like rare diseases. So I entered his WeChat and I emailed him, and he was so generous and kind. He just invited me to his class, the Yuanpei class in Peking University. It's an online lecture, and I learned 3 lectures about Pompe disease, Fabry disease, and Kennedy disease, right? So they were all links to their organizations and way to contact them in the end of the lecture. So I just contacted the 3 of them. Only Fabry disease answered me. So this is now, and I'm going to see if Fabry disease is going to make an interview with me. But to begin with, let's know something about Fabry disease.
So first, let's go into what is Fabry disease. So most people probably had never heard of Fabry disease, which has an extremely low incidence rate, estimated at 1 in 100,000 in the general population. According to a report by Region Hospital affiliated with Shanghai Jiao Tong University School of Medicine, the prevalence of Fabry disease among patients with end-stage renal failure on dialysis in China is 0.12%. Fabry disease is a rare X-linked genetic lysosomal storage disorder. It is caused by the mutations in the GLA gene, which lead to reduced or absent activity of the enzyme alpha-galactosidase A. This enzyme deficiency results in the inability to effectively break down the metabolic substrate globotriaosylceramide and its distylated derivative, lysyl-GL3. These metabolized substances accumulate in the kidneys, heart, nervous system, and skin, leading to multi-organ damage and potentially premature death. The life expectancy of male patients is reduced by about 15 to 20 years, and for female patients, it is reduced by about 6 to 10 years. Depending on the organs affected, the clinical symptoms of Fabry disease can be diverse and non-specific, which often leads to delays in diagnosis and frequent misdiagnosis over many years. Data shows that the average time from symptom onset to diagnosis is 14.8 years, with delays of several decades not being uncommon. Then, what are the typical symptoms of Fabry disease? So, the most common initial symptom is acroparesthesia, the neuropathic pain. The intensity of this pain experienced by Fabry patients is beyond what normal individuals can perceive and understand. Other symptoms include hypohidrolysis or anhidrolysis, the reduced or absent sweating, kidney damage, angiokeratomas, joint pain, decreased exercise tolerance, eye abnormalities, cardiac issues, and hearing loss. In the later stages of the disease, the kidneys, heart, and brain are the primary organs affected, and damage to these organs can be life-threatening. In addition to physical symptoms, many Fabry disease patients suffer from psychological issues such as depression and anxiety due to a decreased quality of life and social isolation. Plus, the clinical manifestations are generally more severe in males than in females. These are the introductions about Fabry disease, and now let's see an interview with a Fabry patient.
So in the interview, I first asked him about his own story. It all began in 2010 when he was just 8 years old, suffering from unbearable pain in his hands and feet, along with frequent colds and fevers.
The local hospital dismissed it as growing pains and prescribed calcium tablets. But after a year of taking the tablets, his symptoms only worsened. Desperate, the family embarked on a journey seeking medical help, visiting every major public hospital nearby. He was diagnosed with conditions like rheumatoid arthritis, lupus, and neuritis, but none of these diagnoses were definitive. Despite treatments, his conditions didn't improve. His childhood was marred by excruciating pain and mental anguish. In middle school, his suffering drove him to sit on the dormitory railing, contemplating suicide. He later admitted that he truly wanted to end his life. It was only thanks to a quick-thinking teacher who caught his parents that a tragedy was averted. By middle school, the pain was so severe that he couldn't live or study normally. He had to apply for homeschooling, further isolating him and intensifying his suffering. Desperate once more, the family continued the search for answers. Eventually, they turned to Beijing, visiting renowned hospitals, endocrinology, rheumatology, and even traditional Chinese medicine departments, but to no avail. In 2017, with their savings depleted, they decided on one last attempt at Beijing Children's Hospital's neurology department. Miraculously, the attending doctor, fresh from an international rare disease conference, suspected Fabry disease, a rare condition, based on his symptoms. He was initially overjoyed at the diagnosis, but his mother's reaction was somber. The medication for Fabry disease was exorbitantly expensive, costing $300,000 per year per person, when the average annual income per person in his country was paying 30,000 yuan. This was an insurmountable burden, especially since Fabry disease often affects multiple family members. Time was running out. Fabry patients typically begin experiencing organ failure by 25 and may die in their 40s. At a support group meeting, he saw a fellow patient with kidney failure and darkened face. He was terrified that this would be his fate. His illness made him irritable, further straining his mental health. As he neared 20s, approaching the critical age of 25, his anxiety grew. He began visiting the hospitals daily, pleading for help. Initially, his efforts were futile, but his persistence finally paid off. Before turning 25, he managed to secure the medication at a significantly reduced cost, down from $300,000 to 300,000 yuan, and eventually even lower. He finally got the medicine. This was his story, but it's also thousands of Fabry patients' story, and it's still happening now. After hearing his story, I was so touched that I wanted to know more about taking the medicine. He explained that the situation was the sky-high drug that has entered the medical insurance could not enter the hospital because the price was too high, which would affect the assessment of hospital departments. Just like the story we talked about, there were so many difficulties requesting for lower prices. The disease already made life hard. Now here are other boring problems. But even when the price was lowered down, there are other issues on the way of getting the medicine, and here points out the importance of the last mile problem. For example, the Mr. I interviewed had to come to Beijing for medicine, and that costed a lot since he lived outside of Beijing. Obtaining and affording medication for rare diseases is incredibly challenging. Fabry disease is fortunate to have seen significant progress in treatment options. However, many other rare diseases still need more support. For example, Pompe disease, as I learned in a lecture at Peking University Yuanpei College, still has very high medication costs that only a few can afford. This is the purpose of our interview today. I hope that by sharing this story, more people will become aware of rare diseases, pay attention to them, and help ensure that treatments for these conditions become truly accessible and effective. So finally, I also asked him about his expectations for the future of rare diseases. And what he said was that he hoped that there will be improvements on research and development of medicines and financial security. He also hoped that society can show more compassion and equality toward those with rare diseases, as there is still much misunderstanding. He used to be carried by his mother in a hospital due to the excruciating pain that prevented him from walking. but people would stare or point at him and judge and whisper without getting to know more information. These are the real problems. So today, I hope to appeal for more attention on rare disease and more compassion and understanding for our rare disease friends. Maybe one is too little for a change, but public can be invincible. Together, we can make a change and a better future for those who are suffering from disease. Thank you for your time and attention. Thank you.